This is George standing behind me. I've known this man for a dozen years at this point. I've known him since I was in Raleigh and practicing there. I've known his father, known his family. And this is a man who came to see me, if you want to cut short his whole story into one line. He said, I don't want to compromise my life. You keep fixing my shoulders. He was one of those attitudes where if I'm a golfer, I'm going to continue to golf. If I'm a thrower, I'm going to continue to throw. In his case, he's a martial art expert. He is, I call him a rock climber. His nature of his work is such that a lot of overhead, heavy lifting work, and he's a tough, fit guy, but he did not want to be in pain, and he did not want to compromise his activity. Over years, we have, George, tell us what, two surgeries on one shoulder because it kept tearing. And
well, when I first met you, the extent of my injury was so severe that I didn't want to let anyone just handle it. And
Correct.
Dr. Singh was the expert in the field. He had handled a lot of athletes, and he had a lot of plaques hanging on the wall, and I knew that he would be the one that would put me back together, and I could be able to use my shoulder and have a better quality of life.
And that's the kind of, today I would call him more of a friend than a patient, but he has stuck through his shoulder pains, and he's been through a lot, but he's pain-free today, and he's functioning with both his shoulders. And he asked me that question again today: can I do push-ups? Can I pick up heavy weight? And so, we've gone through this talk a few times.